Hello, welcome to a new tutorial presented by the SchrDbb. In this tutorial, we're going to see infections and infected ulcers. So, in this tutorial, we are going to visualize infection and infected ulcers by using the SchrDbb algorithm. So, we're going to start with the disease, and then we're going to have the differential diagnosis and endemic disease. Then we have the cause, then we are going to have the complication, and then upward we have the background, and then down we have the prognosis. Now this diagram corresponds to another diagram where the cause is going to correspond to the pathogenesis. The cause corresponds to the pathogenesis, then the disease is going to correspond to the mechanism. Then we're going to have the complication that corresponds to the pathophysiology. Then in the background, the risk factors or the epidemiology, and then lastly we have the follow-up. So this is the SchrDbb algorithm that we're going to visualize on infections. Now, in infections, you need to understand that when you want to understand the mechanism of infections, is it clear? So here in this tutorial, we're going to visualize the mechanism of infections. We're going to visualize the pathogenesis of infections. So how does infection, what are the etiologies of infections, the pathogenesis of infections? We're going to visualize the pathophysiology under which infections are going to work. And then later on, we are going to specify now one pathophysiology, which is an infected ulcer. You're going to visualize actually one pathophysiology, which is the infected ulcer and how it works. And then later on, after visualizing it, you're going to see the clinical presentation of infections, the management of infections, and the follow-up. So those are the different things that you're going to visualize. So this is a start for the introduction of infections. So from here we say, thanks for your kind attention. Let's go to the next part of our tutorial.